Hi, I'm Amanda Priest, and I am going to be leading us in this module on assessment and the special education process. Before beginning with our content, I would like to introduce the Birch Project to those of you joining us for the first time for this module series. The Birch Project is the Behavioral Health Integrated Resources for Children project. Its mission is to provide professional development and resources for schools, as well as to strengthen coordination of behavioral health supports across school and community agencies. The Birch Project is led by faculty members from UMass Boston and UMass Amherst and is sponsored by Boston Children's Hospital. For more information, please check out our website at umb.edu/birch. So as I said, my name is Amanda Priest. I am a second year doctoral student in the counseling psychology program at UMass Boston. And prior to coming to UMass, I worked as a special education teacher in the Boston public school system. We would like to extend a huge thank you to the paraprofessionals and mentors who made these modules possible. They provided us with invaluable insights into the work that they do, which helped us develop the module that you are about to view. So for our learning objectives, participants will become familiar with assessment processes and tools that can be utilized in community settings. They will develop a general understanding of the special education evaluation process in educational settings. They will also understand processes for collaborating with team members and across systems. Here is our agenda for this module. So we're going to talk about the history of special education. We're also going to speak about the history of the Children's Behavioral Health Initiative. We are going to talk about special education assessment and what that process looks like. We are going to talk about CBHI assessment and how that works in the community. And we're also going to speak about collaboration. So we wanted to start out by quickly reviewing what you learned in the last module. First, responding to challenging behaviors starts with identifying what the function of those behaviors are. Additionally, you want to be consistent. Let students know what to expect and reinforce pro-social behaviors as often as possible. And thirdly, restorative justice practices improve school climate through reducing racial discipline disparities and reduction in repeated offenses. To get started, we're going to learn about the history of assessment in special education to frame what we are talking about. So, only 46 years ago, children with disabilities were often refused access to education. For example, in 1970, only 1 in 5 children with disabilities were educated in US schools. Thanks to advocacy efforts and lobbying from families, Congress passed the Education for All Handicapped Children Act in 1975. This act required all public schools to provide an appropriate education to children with disabilities between the ages of 3 and 21. In 1997, this act was amended and it became the Individuals with Disabilities Education Act. This guaranteed a free, appropriate public education to all children. It also improved how children are evaluated and dictated specific regulations for the special education assessment process. Now we're going to talk more about the history of the Children's Behavioral Health Initiative and what services they offer to families. In terms of mental health services and assessments, the case of Rosie D led to the establishment of the Children's Behavioral Health Initiative, or CBHI. At the time that this lawsuit was filed, there were no in-home services provided for children with serious emotional disturbances. A lot of times, these children were detained in hospitals or forced to attend residential treatment when in-home services would have been more appropriate. In-home services have been shown to be more effective and less costly for some children and families. Rosie D was the lead named plaintiff in this case, but it also included 8 other children who were eligible for Medicaid. The argument was that there was a failure to provide the requisite medical services that are guaranteed under the Medicaid Act. After 5 years of litigation, in 2006, a judge found the Commonwealth responsible, which led to the development of several services, including CVHI. In his decision, Judge Michael Posner stated the following: the result of this failure is that thousands of Massachusetts children with serious emotional disturbance are forced to endure unnecessary confinement in residential facilities or to remain in costly institutions for longer than their medical conditions require. So, as we learned from the history of CVHI, it is part of the resolution to the Rosie D case, and it ensures that for all children who are covered by Mass Health, the following things have to happen. So, primary care providers must screen for behavioral health conditions. A variety of home and community based services will be provided to children and families. And all clinicians treating children must utilize the child and adolescent strengths and needs assessment for assessment purposes. We're now going to spend some time talking about the special education assessment process and what that looks like. So, how do we determine who needs to be evaluated for special education services? Sometimes the recommendation will come from a teacher or other school professional. Typically, schools have teams which are often called a student support team or child study or instruction support team. You can reach out to your administrators to find out what the team at your school is called. This team meets to discuss student progress and student concerns and identify those who will need to be evaluated. A parent or guardian can also make a request for an evaluation. The school does not have to complete the evaluations based on this, but they must respond to the parent. Additionally, it is required that the schools have parental consent before starting the evaluation process. Once this consent is received, the school has 45 days to complete the evaluation. So, what does the evaluation process look like? Several tools and assessment methods are utilized throughout the process. This picture here shows the Wechsler Intelligence Scale for Children, or the WISC, which is an intelligence test that measures several cognitive domains and is most commonly used. The evaluation process is looking to determine if a child has an educational disability and also if they require specialized instruction due to the disability. So, some children may be identified as having a disability but not require special education services. Evaluation really looks at all aspects of that child's functioning. So they're looking at academics, development, functional capacity, cognitive skills, communication skills, social, emotional, behavioral skills, academic skills, as well as motor skills, vision, and hearing. After all the professionals involved have completed their part, the assessment report is written and the meeting is scheduled. This meeting is known as the Individualized Education Plan or IEP team meeting. During this meeting, all professionals involved with the child and the parent or caregivers attend to discuss next steps. If the child's parent or guardian does not speak English, they are also entitled by law to have an interpreter present at the meeting. If it is determined that special education services are warranted, an IEP document will be written. Each person who was part of the evaluation process and a special education teacher collaborate to write the IEP. This document includes goals and a time frame for completing those goals. The document gets reviewed and updated by the team every year based on the student's progress. Every 3 years, the team is required to do a reevaluation. So basically, the whole process that we just talked about with the testing and the team meeting, they do all of that again to see if the child is still eligible for continued services. Once this is done, it is then sent out to the parent or guardian to sign and approve. Services are not allowed to start until the signed IEP is returned to the school. So, if a child has been approved for an IEP and it has been written up but not approved yet, You cannot start implementing the strategies indicated in that IEP until the signature is received. As a community provider, if the parent is comfortable with it, you can try to figure out how to go to the meeting slash get invited if you feel you have input that you would like to provide. Now we will talk about what assessment can look like in a community setting. Not all youth are eligible to receive CVHI services, although care options are expanding. Any youth that is receiving CVHI services has received a diagnosis from a mental health professional that comes from the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, or DSM 5. A clinician will complete the child and adolescent needs and strengths assessment, and this is used to guide treatment planning. In the state of Massachusetts, the CANS is utilized to improve collaboration among professionals and family and and is sorry, among professionals and families responsible for planning a child's care. We have two versions of it. One is for children between the ages of birth and 4, and the other is for children between the ages of 5 and 20. Massachusetts version allows the evaluator to determine whether or not he qualifies for a serious emotional disturbance. The CANS has to be updated every 90 days. We are now going to talk about the importance of collaboration in these processes. School and community collaboration is absolutely vital in supporting the best possible outcomes for youth. Those working in schools are important to the community because they are often the first to recognize when a youth may have behavioral health needs that are not currently being met. Mentors can be an invaluable asset to the mental health personnel in schools if the family grant permission for the school and the mentor to consult. For example, the team can provide insight into how you function in the community and the home environment. School professionals can provide information about the student's strengths and struggles. Both school and community support paraprofessionals, support staff, and mentors can support building of student strengths, natural support systems, and support them in meeting their goals. Collaboration allows for a more comprehensive wraparound approach in which all providers and families are on the same page. This type of teamwork is likely to allow the use of the best support possible. All right, so the three biggest takeaways from this module are: first, the assessment process for special education can be lengthy and challenging to understand. So now that you know a bit more about it, you might feel more confident in helping families navigate this process. Assessment and diagnosis in community settings differ from the special education evaluation process in school settings. Finally, collaboration between schools and community providers can be vital to the student and family success. Here are some resources where you can learn more about CBHI and its programs, the special education evaluation process, and more about the assessment methods that are used in the process, as well as some of the identified disabilities that may be named. So, for the rest of this time, the rest of these slides provide some suggested activities that people can do either on their own while um, finishing up this session, or if you're in a group, you can do these things together. So the next few slides are a pop quiz, um, and I am going to go through and I will provide answers at the end. So the first question is, which of the following is not a result of the implementation of CVHI services? Feel free to pause this, reflect, write down your answer, and at the end you can check if you were right. The special education IEP team includes the following individuals: school psychologist, chair of student support team, general education teacher, special education teachers, the parent or guardian, and any other evaluators who were involved, i.e., occupational therapist, speech pathologist, school adjustment counselor. True or false? Which of the following are benefits of collaboration among team members as well as across school and community settings? So, just as a review, like I said, if you pause this and spend some time on these, the answer to the first one is C, led to the creation of mental health emergency rooms for youth. That has not happened yet, but it would be wonderful if that would happen. The answer to this one is true. All of those people are involved. And the answer to this one is D, all of the above. Here are our references. Please remember to follow the link and complete the evaluation form for this training. And you can contact us at our website, which is www.umb.edu/birch. There you can sign up for our subscription list to get more information on best practices related to supporting the behavioral health needs and well-being of youth. We would really love to hear from you, so please reach out to us with any thoughts or questions.